Welcome to the Occupational Safety Leadership Podcast, episode number 156. And in today's episode, we are going to talk about heat exhaustion. In the previous one, we talked about heat cramps. The second level of severity, we'll call it for lack of a better term, is heat exhaustion. And then in the final episode, we will talk about heat stroke. So let's just get right into it and talk about symptoms and treatment. Symptoms, things to look for. So let's just kind of go down the list, and I wish that I could say that each one's going to be super easy to spot, but some of these are really obvious. Others are maybe not as obvious, and it may take a little more examination and just kind of watching folks. So first one, heavy sweating. Second one, cold, pale, and clammy skin. You can also have a fast but weak pulse. Nausea or vomiting, muscle cramps. That was a really big one in the previous one we talked about. Tiredness or weakness. I think that's really difficult to spot in somebody. Headache, dizziness, and then finally fainting or passing out. So those are the symptoms to look for, and I wish that I could say you're going to find all nine in varying degrees. It'll be really easy, but it may be only a few are obvious, but you can still tell the person needs help from the heat. Let's go on and look at what to do. So move the person to a cool place, loosen their clothes, put cool, wet cloths on their body, or in a ideal sense, you can give them a cool bath and have them sip water. And then finally, get medical attention right away if they are throwing up, the symptoms get worse, or the symptoms last longer than 1 hour. That is it for today's episode. Short and sweet episode number 156. We talked about heat exhaustion, the symptoms and treatment, and what to do, of course, when this happens, and when to finally escalate it and look for a higher level of care. So 155, we talked about heat cramps, and in 157, we will be talking about heat stroke. I'd like to thank everybody for joining me today. Thank you. My name is Dr. David Ayers. Thank you, and have a safe day.